are part of this research that's beginning to study the long-term impact of COVID-19 on EMS. So describe the need for this type of research.
Right, so one of the biggest challenges that we've found when it comes to thinking about COVID-19 is the whole fact that when you think about first responders, they are affected in a completely different way from a lot of us who know the patients coming in and already are prepared with all our PPE. Our first responders, they have no idea. They knock on a door and they walk in and they take all the risk for you and I. And so a big part of our research is focusing on identifying and telling the story about what they're going through on an everyday basis.
And we learned from Lieutenant Turano earlier, who's participating, that this is going to be a 5-year thing, and he's going to be filling out paperwork weekly.
Yes.
So yeah, what sort of things are you going to look for in that?
Yeah, so the overall study itself is for 5 years, and we're following both first responders as well as their household contacts. That's their wives, their kids, all that kind of stuff. And the whole idea behind that is recognizing that not only our first responders are affected, but also their families. And so what we're going to follow is we're going to follow not only some of their surveys and what they're experiencing and what kind of PPE they're using and things like that, but we're also going to follow if they become positive for COVID-19, if they're vaccinated. And when we break down our study, we're following some surveillance of the population. So what's happening with them. The second part is their serology. So what's happening in their blood, or do they have antibodies? And last but not least, communication. How is this information transported to them, and how are they taking it all in? And are they hesitant to get the vaccine? Things like that.
Why do we need to know the long-term impact of COVID-19? I mean, is it because it's new and we just don't know?
Yeah, so that's a great question. A big reason why we really want to focus on the disease itself and understanding it is that its impact is more than just right here today. It also impacts people all downstream and also impacts all their family members. So understanding that whole piece and how all that interfaces is not going to only help us manage COVID-19, but also for future pandemics. We know they're going to happen. We just need to be prepared.
Wow. What are some of, do we know any long-term, I mean, we can't possibly know any long-term impacts of COVID yet, do we? Like loss of taste and smell, like permanently, is that a thing? I mean, do we know any of that yet?
So we have some ideas of some of the complications that patients are facing with COVID-19. The whole focus of what we're doing is we're looking at that population and trying to understand if these kind of things happen. Our biggest focus really is what's happening with vaccinations. So are the vaccines staying as strong as we would think? Are their antibodies staying up? How long are they staying up? All these things are things that we can answer and get a better idea of, do we need boosters? But more than that, we're not only following people who are vaccinated, we're following also people who are unvaccinated. So we're enrolling anyone who's a first responder in our study.
Yeah, crazy. Kevin, do you have any questions?
I asked the firefighter earlier, you know, they're living and working in small conditions.
Yes.
And they're the perfect carrier as far as giving it to a stranger they're working with, taking it home. So kind of, I guess, elaborate on first responders and how they can be transmitters.
Yeah, so when we think about our first responders, they're the first ones in every home. They're knocking on the door, and so they're also the ones who could get infected. And they could take that back to their households, but more importantly, they could also take it back to the stations. So understanding what's happening in the station itself, as well as what's happening in the home, is one of the key aspects that we don't have a lot of answers for about how it's transmitted. So that's a big goal of our overall study.
And then will this, sorry, you can finish saying what you're saying.
No, I had another thought actually.
Sure, yes.
So one of the key things for us, especially around EMS week, is really thinking about the people who are taking care of us. These first responders are coming in our homes and helping us when we're the most sick. We don't realize all the stress and strain they themselves are put into. A lot of them are going through burnout, sleep disorders, and even thinking about cardiovascular disease. And now we've added COVID-19. So for our research group, this is really motivating to be able to give back to this group of people who've given so much to us.
I'm happy you actually said that, because that was something we talked about with them at the firehouse earlier. Is we know we've been getting more information now for some time about their exposure to carcinogens and the damage it can do on their bodies and cancer causing, you know, like you said, all of these other things they're exposed to, and now COVID on top of it all. So is that kind of the reason behind focusing on this group first?
Yeah, that was a big focus for our whole group because we realized early on, especially after we saw what was happening in other cities like New York, where first responders were really being infected with COVID-19, we recognized that this was a population which was being treated and affected in such a different way that we needed to really make a focus on them, because so much of what they're going through is the larger story of what the COVID-19 pandemic's all about.
And again, I talked to the firefighter about this. You have one first responder catches COVID-19, goes back to the station or
everyone else.
That could wipe out an entire station.
Yes, that's our whole workforce. So one of the big concerns that we have when we think about our first responders being infected, once one person gets infected, everyone else has the potential. So now suddenly you have a whole station, a whole community, a whole neighborhood which may not have first responders who are ready to serve. So if we don't understand what's happening in that community, well, we're putting ourselves at risk and putting our families at risk. So it's important for all of us to really focus on this population closely.